Hi there. This video is a quick overview about how our systems can help you run your flu and possibly COVID campaign this year. We'll start with clinical reporting, and it's part of our prescribing module, so you'll need access to that if you want to use it. And we've done a folder for flu and COVID. And the idea of these reports is that they kind of work through everything you need for running your flu season. The first couple are for patients who might be eligible but aren't currently identified as definitely eligible. So the first one is those who were coded last season as needing flu and given the vaccine. So those need manual review to consider whether to code that again. And then, as you're probably aware, if patients have got a BMI that's over 40, they're eligible. We've said if they've had a BMI since the start of last flu season that's over 40, that's fine. But if it's before that, we really could do with a more up-to-date one. So this report finds those patients. There's a comms annex preset. If you're using our pathology module, that will do the BMI calculations for you. And it's only showing one patient at the moment because we ran this the other day here. Next are flu PSDs. You may need to use different wording, but these are basically broken down into different categories, and they're all the patients our system has picked up as eligible. It's up to you whether you want to take this approach. You may want to do some sense checking, look at some individual patients. You could use the blue eye and see how the reports are structured and check you're happy with that. Our view is that this approach is more robust than certainly what practices have done traditionally. In my experience as a practice manager and working with lots of practices, often it was, here, can someone sign this list? And actually, the person signing the list didn't necessarily know whether those patients were eligible. So this shows all the patients who are eligible, and those PSDs then enable HCAs to give the flu vaccine. We've got two codes that we add when we do it. There's one code that's for PSD, that's this XAZ081, and then we also tie another code at the same time. That means our system can work out, is the flu PSD on this patient record? And if it is for HCAs, it will let them give it. If it's not recorded, it will pause and say, hang on, are you sure this is actually okay for you to do? The other advantage of doing this at the start of flu season and getting all of these added is that it will enable opportunistic vaccination by HCAs through the season. Up to you whether you use it, but we'd recommend it. Next, we've got the flu invites, and this is ignoring COVID eligibility. So if, as a practice, you're doing flu, but perhaps the PCN is doing COVID, this is the section to use. We've split it into child and adult invites, first, second, third. The reports are built to use appointment links, and we've created appointment links that you can use if you want. And we've also split it a bit further, so you've got under 18s, under 64s, over 65s. You could use the same link if you're just doing them all together, but if you want to separate out your clinics, so you're giving the same vaccine to all the same patients, that would support you doing that. If you need help with links, then see some other videos about how to do that, or give us a shout. Other practices we know, you're doing flu and COVID combined, so if a patient needs both, they have one, perhaps slightly longer appointment to do those together. And so this is then split into those who need flu and COVID, those who need only COVID, and then those who need only flu. And again, those who need only flu is broken down into adult and child. So quite a few reports, but hopefully the right ones are available for you to use. We've done preset comms annex. We've not done a letter yet, but happy to if you want. Finding a lot of practices these days are choosing to call patients if we can't text them, just given the costs involved. And then we've got visits, the same sort of setup, and this works in the same way that our recall system does for working out who's entitled to a visit and who's not. Do watch the video on that, because there are some data quality things. You'll often find patients who are coded as a care home who clearly aren't, and vice versa. So again, we've got all those who need the flu as a visit, and either all of the visits together or split into care home only or housebound only. And then again, if you're doing them a combined way, you've got the different categories there. And then lastly, this is just a sort of monitoring to see how you're getting on. So who do we think is booked but not entitled? Who's booked in the different categories? Who still needs to have it given. In terms of how we work out whether it's booked, there is no nice flag that says, flu booked or flu injection, but there is a flag for injection. So if you use with your slot types that flag, let me just show you actually on ours and show you how we've done this. So we can't report on slot types, but we can report on appointment flags. So if we come to, say, flu clinic, this one here, a men's slot type, and we've got this one here ticked injection. So if the appointment is sort of 5 minutes or less and it's got that injection flag, the system will assume that it's booked for flu or COVID or both. Also, if you're using the recall system and it thinks that the recall appointment is booked, that would also exclude them from these invites, because generally, I think most practices, if they're booked in for an annual review, a nurse or HCA would give the flu vaccine at the same time. If that's a problem for you, let us know and we can tweak that. Next is sort of prompts and how we get things booked in. So if you've got access to this module and a patient's entitled, you may have spotted this alert appearing. Again, if you want it to do flu and COVID combined, let us know, because we need to add you into that option. We've got the sort of fairly normal things like invited or declined. Book now. It won't take you to tell you which free slot search to use. That's for you to configure and decide how you want to do it. Give now takes you to our flu vaccine template. This template is really specifically built to make it as quick and safe as possible, really, to record giving a flu vaccine. It's been developed over the years with nurses, sort of telling us what they want to see on the patient record, what things they might want to see flagged. So most of the time you'll see lots of nice green ticks here. This test patient is on methotrexate, and so it's flagged that and shown you that. They're also on warfarin, again, is flagged that. You can also see that a PSD has not been recorded this season for this patient. You can see what reasons this patient has for being eligible. In terms of actually recording the flu vaccine, the idea is to make it as quick and easy as possible. So you would click this, give flu. If you are a nurse or HCA, generally the system will pick that up and realise that's your role. But because I'm neither, it asks me the question. So because there's no PSD added and none even code of any sort, it's saying basically the default is to stop and cancel. But I could record that the flu is PSD has been recorded in some other way. If I'm a nurse, it won't go through that check, and it will just take me straight to the right vaccine. What it does is it looks at what's the patient age to work out what vaccine to give, and then also, again, how it's been configured for your practice. So if it's bringing up the wrong thing, or you might see a message that says, you've not told us yet what you're using, drop us an email to support@wellbeinnovate.co.uk with essentially the details of what vaccines you're using for what age group, and we can configure that for you. If I OK that, it's using an old batch from last year, but I'll just show you. So you can see here, if I go to the journal, you can see what things are coded. There's other quick entry, like if you need to put extra notes in, you can do that. If you want to tick they've had it elsewhere, that kind of thing, those are options there. Where are we? It's got some other bits that I was messing around with when I was trying things, but basically vaccination given under PGD, because I'm a nurse, check the patient's fit and well, and advice given, and there's various codes. Consent is automatically recorded and so on. So it's trying to make basically the flu administration as quick and as safe as possible. You don't have to use it at all. If you've got the module, it's there. If you've not got the prescribing module and you'd like to find out more, perhaps book a meeting with me or drop us an email. Happy to talk through all the other things that the module includes. One last thing to add. We are in the process today of updating the sort of sidebar on the side of all the templates. Hasn't been done on this one yet. Will be done later today. But we've added we are adding vaccinations to it, so that if you're in other parts of the system, so you're doing that annual review, you can then get straight to this template. Hope that helps. If there's anything more you need to know or things you think would be good to add in here, please let us know. Thanks.